Good morning, everyone, and thank you for joining me today. First of all, I want to tell you that this is the collective work of not just myself, but my entire incident management team. And it's only right that I share each and every one of them and their roles. First and foremost, I have to tell you, Deputy Mayor Elliot Holgren with the City of Fishers, City Attorney Chris Greisel, Ashley Elrod, Communications Director, Steve Arusa, Fire Chief, Ed Gephardt, Police Chief, and Megan Baumgartner, Economic Development Director, have been a part of my incident management team throughout this entire COVID event from first phase. As we know, COVID hit the borders of Indiana and Hamilton County, all the way through as we tried to maintain operations and take care of those people who are sick. And now as we turn to an eye towards recovery, they have been with me and heads down every single day, and I'm greatly appreciative of the work that they've done. Today is a conversation about an action-oriented, comprehensive plan that will allow our city to be in a strong position as the governor and Dr. Box make their decisions around recovery and reopening. Our City of Fishers will be ready. And I want to talk through a variety of policies and programs that I plan to propose to the City Council and enact in the coming days. For a number of years, the public health and the economy have been viewed in separate verticals. The integration of public health and the economy have been not always integrated. We can no longer look at our economy without looking at public health as well. I have a slideshow here I'm going to pull up. One second. So today, in general, as we walk through this policy framework, I want to talk through how this integration is going to occur in the City of Fishers. And there's a lot of unorthodox concepts here and a lot of creativity that was required in order to ensure that public health and the economy are synonymous. For many years in city government, the focus was, and I've been in city government now for over a decade, infrastructure, public safety, and economic development. We didn't necessarily consider public health as part of our responsibility and our role. That can no longer be the case. And so today, we're going to talk to you a little bit about how our plan ensures that in the future, our community, through the implementation of public health infrastructure, as well as creative economic development incentives, will allow for talent attraction, consumer confidence, and enabling commerce. This plan is truly a future-focused solution. I think this is a really important nuanced point to make for our community. The idea that this is focused on the COVID epidemic is true. It is very much something that we have to deal with and we're going to manage. But this is about reopening our community. This is about businesses moving forward, finding a new normal, people being able to provide for their families, our organizations and the vibrant culture in our faith community, making sure as the governor and Dr. Box start to phase in reopening that we are right there alongside our community as we figure out what that new normal looks like. So let's talk about the balance of public health and the economy and our approach to addressing some of those issues. First and foremost, from my opinion, at a local government level, we cannot open up the economy if we do not start to put things in place that have a strong public health foundation. And so today I'm here to announce a series of efforts to ensure that we can do just that. First and foremost, under Indiana law, a second-class city can implement a public health department. That will be the first action that I ask the city council to do tomorrow morning in an emergency council meeting, is to enact a Fishers City Health Department. And we'll talk a little bit about how the establishment of that department plays into the overall economy of our community and why this is so vital. Second, it's my intention with the establishment of the Public Health Department and the fact that we have been a good steward of our tax dollars, that we will use a roughly $2 million number out of our cash reserve policy to be able to provide testing for any Fishers resident that feels they need to get a test. By establishing the health department and having medical direction under the health department, we will be able to do that in a safe, efficient, and effective manner. So by the end of next week, it is my hope that any Fishers resident that needs a test of COVID-19 will be able to do that. I'm very proud of the Fishers Fire Department in their willingness to step forward. They will be administering the tests. And I'm also very proud of the partners that we brought on board to accomplish this. First and foremost, I can't thank Brian Mills enough at Community Health. When I called him and told him about this idea of a truly community-oriented, focused response and recovery to COVID, he stood up right away and said, Scott, let Community Health help you with this. Community Health has been alongside us through this journey over the last 10 days. It's our intent to use Community Health for our medical direction in our public health department. And I also have to say that we have had an extraordinary opportunity with Mid-America Clinical Laboratories and Dan LaRue and his team, along with Quest, to be able to provide the supplies, to be adequately staffed and supplied to provide the tests as we open up late next week. Along with that, as we reopen our community, we know that the businesses are going to need the opportunity, the availability, and the access to testing. So another key component of this health department will not only be testing for residents, but as our businesses open back up and they want to ensure that they can provide consumer confidence, they can provide employee confidence, and they can enjoy a more safe environment for their business community, they will be afforded the opportunity to utilize our drive-through test site. They will be afforded the opportunity to use our software application. And that really dovetails into step 4. Everyone right now, and I understand this, is very, very focused on testing, but that's one step of a multi-step process to truly ensure that we can bring back our economy and move forward as a community and as a collective. Once we have testing established, the ability to have real-time data analytics is critical. That's why today I'm announcing also the establishment of a relationship with a company called Qualtrics. Qualtrics is the software backbone behind the entire state of Utah's effort to test as many residents of Utah as possible. With this software application, we will be able to not only have real-time data on the testing that is occurring in the city of Fishers for our residents, but businesses will also be afforded the opportunity to have their own personalized web portal where if they want to have their employees tested, they can have a real-time dashboard to be able to see what's going on with their employees, which I think will be an extraordinary step forward to ensure that we're using best practices for the safety of everyone involved. Obviously, once we have that data is information, and information is power. With this to be able to respond quickly to the issues that might pop up. So we will be setting up a rapid response team with our public health department so that if a business were to have an outbreak of COVID-19, we're going to be able to isolate that, deal with it, address it, and hopefully keep that business in operation. Again, this is not about what has happened over the last 4 or 5 weeks. This is about what are we going to do 5, 6, 7, 10 weeks from now. It's critical that we have the infrastructure, the capabilities to address these issues so that we can keep our economy going and that people can earn a living. Finally, and one of the things that I'm probably most excited about, it's not just about the testing infrastructure, which I think the governor and Dr. Box and everyone's doing their best efforts to get testing throughout the state of Indiana. And I'm glad that we can play a role in trying to help get that done here in the city of Fishers. But it's this comprehensive approach. So if I'm a salon owner, if I'm a restaurant owner in the city of Fishers, and I'm starting to think about the daunting task of reopening, there's a million questions that I would be thinking about as to how do I stand this up and make sure that I'm safe, make sure my employees are safe, make sure residents walking in are safe. It is our intent and our goal will be that every business facility in the city of Fishers will have contact with a team of public health experts that will reach out, meet with them, talk through the CDC guidelines, the state's best practices, so that we can ensure that we're right alongside them as they tackle re-entry into our local economy. Now, public health in itself, that public health infrastructure in itself is not enough for a comprehensive approach to reopening a community. We also understand that we've gone through a very difficult economic time. And we realize that we have to have a series of economic policies, not only at the federal and state level, but also at the local level, to ensure those businesses that have been most hurt by this COVID-19 event have the opportunity and the tools and the capability to move forward. And so today, I want to walk through a series of what I think are innovative and helpful tools for our local businesses that we plan to implement in the very near future. First and foremost, and I've touched on this before, every business in the city of Fishers will have access to our software platform that we're acquiring from Qualtrics that will allow them to create a customized web portal to do testing of their employees if that's what they feel is the best practice moving forward. And they'll be able to have real-time data in the sense of a dashboard that lets them know how many people have been tested, how many are infected, all those types of things that would allow an employee and an employer to feel comfortable about stepping out that front door and going back to work. Secondly, we know that there is a narrow and key demographic of our business community that has been adversely affected and having a very difficult time. We've been watching very closely. We just got off a conference call, in fact, with Senator Todd Young, talking about yet another round of PPP loan programs. And we realize that the federal government has served a critical role in being able to prolong the ability of a business to stay open and keep their staff on board through this difficult time. But in contemplation of the fact that when Governor Holcomb and Dr. Box make the decision to bring our businesses back online, at that point, there's a lot of our small businesses here in the city of Fishers that are probably at a point where they've depleted every cash resource that they have. And the idea of buying food if you're a restaurant, buying supplies if you're a salon, floating payroll for 2 to 4 weeks as you've depleted all of your cash to date could be a very, very daunting and at times prohibitive situation for a lot of our businesses to get back to what they were doing before. And so today we're announcing the implementation of a startup and recovery loan program, which will have nearly $500,000 available. And it will be a competitive loan program that small businesses will be able to apply for as they start to consider reentry into the economy. I have to thank the folks at One Zone Chamber of Commerce. We've consulted with them and worked with them. And we're going to have a panel of business leaders help us in the selection of candidates for this loan program. But we plan to implement this literally in a matter of days. And we're very, very excited about the opportunity to come alongside our local businesses as they prepare for reopening. Safe practice verification. We touched on this a little bit earlier. The idea that as a small business owner, and you might be a fantastic restaurateur, you might be a fantastic salon owner, but I highly doubt you're that plus a public health expert. And so what we plan to do is come alongside each and every one of our businesses, knock on the door with trained public health officials, and just let you know what are the best practices that you should be adhering to ensure that your customers and that your employees feel safe. This verification is not a certification. It's not to say that you have to pass these inspections to be able to open. This is about education, and it's about consultation, and it's about working with you to follow all the best guidelines that the CDC and the governor and Dr. Box come out with. And we really believe that we'll have a tremendous opportunity to be an aid in reopening. The Business Recovery Center. There's every alphabet soup out there right now of different programs that are available to a small business owner. That can be very, very daunting. And so Megan Baumgartner, Economic Development Director, as well as her team, will stand up a business recovery center that will allow all businesses to stop in, have consultation hours, and really work through any challenges that they're seeing, and also probably open some doors to different various government programs that may be available that you're not aware of. We will continue with our signage ordinance ban in terms of we will allow people to have additional signage in the rights of way where before we wouldn't allow that. We want to make sure that as you have your grand opening, that as you start back up, that you'll have the ability to let the community know that you're back in business. Finally, in regard to stormwater utility bills, commercial stormwater utility bills, and I think this is a really important note. This is not residential bills. Stormwater utility bills, we delayed the first quarter payment. We are now delaying the second quarter payment. So the first and second quarter payment, the first payment you will make on your commercial stormwater utility bill will be July 15th. July 15th. We're taking the first quarter payment and we're spreading it out over the other 3. And so we're trying to alleviate that upfront cash as you're trying to reopen your business. We're trying to spread that out on the back end of this year to try to alleviate some of the challenges that I know all of you are having as you try to find the resources to be able to reopen. In general and in closing, what I would tell you is I'm proud of the work that my entire team has done to ensure that we've come up with a comprehensive plan that balances both public health infrastructure and economic development incentives. We want the mom and dad that live in Fishers that want to enjoy the safety of our community also be afforded the opportunity to make a living and provide for their family. So when they walk out the front door, when Governor Holcomb and Dr. Box make the determination to open businesses back up, I want that mom or dad to have a degree of confidence that their city has been working hard so that they can get back to work. With that, I want to open it up to any questions. I know we went through a lot very quickly in terms of a number of programs here, but I want to open it up to any of the folks on the line to answer any questions that they might have.
Hi, yeah, this is Kurt Christian with the Indianapolis Business Journal. I was wondering if you might drill down a little bit into the municipal health department that you all have planned in conjunction with community. Are those new or temporary hires? Are those individuals brought in by community? And if so, it'd be, I think, prudent to name just the scope of that new department.
So under Indiana law, a second-class city can establish a public health department. If council deems this proposal worthy and enacts a public health department tomorrow morning, our intent is that department to follow medical direction by Dr. Indy Lane from the Community Health Network. She will be the medical direction. The department itself will be staffed by first and foremost Division Chief of Fire and EMS, Steve Davison. And then we will add additional staff as we see fit. But for the time being, as we stand this up very quickly, we plan to train our paramedics and police officers to be able to help as we are able to hire additional staff. So the staff will be the city of Fishers. What we were receiving from community health is medical direction, which is not atypical. It's very similar to what we have with paramedics, where they serve under medical direction. Additional questions?
Hi, Mr. Mayor. Eric Berman at WIBC. Couple of questions, if I could.
Sure.
On the health department, why is the Hamilton County Health Department inadequate for your needs? Why do you need the city department?
Yeah, I think it's a great question because I think the word inadequate is probably not the appropriate thing to think through around this. As we look forward, this is not just about a COVID-19 response. This is about how we should address public health moving forward in our community. I don't think any longer that we can separate the two. And so we want a very grassroots effort where we're able to talk to each and every business. We're able to adapt our policies specific to the local economy and the population that the city of Fishers has. And we actually look forward to collaborating with the county on the things that make the most sense. But we really do believe at a local government level, particularly since we provide paramedicine to date, and we're responsible for the life and well-being and safety of our community. We have a great opportunity here to build upon what the county's done and provide an even more customized solution to the problems that we face.
Okay. I also had a question about the testing that you mentioned. The state has talked a lot about the difficulty of expanding testing. There just haven't been enough swabs. How many tests do you anticipate doing, and how were you able to get the necessary supplies?
So we think to start off with, we would do 200 to 300 tests a day. That would be the high side of what we would start with. We certainly felt the same challenges that the state did in finding resources. Obviously, we're talking about a much smaller population base than the entire state of Indiana. And in talking with Dr. Box, I think we all are faced with that same struggle. We were fortunate enough to work with the lab here that's also doing a number of tests throughout the state. And I think what you're going to find is this will get exponentially better over the next 2 to 3 weeks, 4 weeks as the supply chains step up. But for the time being, we're looking at about 200 to 300 tests a day.
And did I understand you correctly? That's available to anyone. That you don't have to have symptoms. You don't have to be in a high-risk group.
We will follow protocol, so that will have to be adopted at our public health board on Monday. And the public health board that will be established and our medical direction will decide the protocol on that. But to be clear, any Fishers resident will have the ability or access to that testing, but we will follow medical direction in regard to that. Thanks, Eric. Additional questions? You might need to unmute. Dylan, you might need to unmute your computer. Never mind. Any other additional questions? Larry, go ahead.
Yes, Mayor. Okay, hopefully you can hear me.
I can.
I know that you have been an instructor in public finance in the past at the college level. The Senate Majority Leader said just yesterday that rather than supporting states, he would be in favor of letting states declare bankruptcy. I know this is a long way from happening, but just as conjecture, if, for example, Indiana was forced to declare bankruptcy, what would that mean for municipalities such as yours?
Well, I do tend to geek out a little bit on public finance. There's no question about that. You know, look, I think Indiana in general does an extraordinary job. We have often been touted as a state to be fiscally very conservative and done a good job at having adequate cash reserves. I think we are in a difficult time now where we've seen revenue depleted significantly, both at the state and local level. And I think all the more reason to be focused on how do we build the infrastructure to be able to open our economy back up in a safe and effective manner. I was talking to a businessman the other day, and I asked him, he was currently closed or significantly modified. It was a restaurant owner. You know, what is your worst case scenario here? And he said, I think I can make it through the closure, but what I can't do is open up for 3 weeks and then have this outbreak pop back up and then be closed again. If that were to occur, it'd be catastrophic. That's why I'm so passionate about ensuring that we create the public health system and not just testing. I think testing is critical. And that's why you're seeing me propose to our city councils investing significant resources in it. But you have to put the entire system together where you have follow-up and you have education and you have coaching, you have interaction with businesses, you have rapid response teams, you have data analytics. All of that has to come together to be able to sustain that economy. We need that economy to be able to supply state and local governments. Clearly, if for some reason the state of Indiana and local governments were to go bankrupt, I mean, you would see a clear and distinct diminishment in the quality of life of our communities. And that's why I think it's so vital that we all roll up our sleeves and get creative, get unorthodox about this, and start to put plans in place that will allow us to enable commerce and to do it in a safe and effective manner. Any additional questions, Ashley? Eric, go ahead.
Yeah, just wanted to return to the earlier question about testing. I want to make sure I'm clear. But when the health board takes that up, you said they follow medical protocols. That's typically been people with symptoms or in risk groups. Are we saying that it is going to be limited to that, or is it going to be, hey, I want to make sure I don't feel any symptoms? Would it go beyond people with symptoms or people in risk groups?
I think it could. I think we have the capacity and the planning to be able to do beyond that. But what I'm saying is that as mayor, the best thing that I can do is put a system in place that puts the medical experts in the captain's chair for that. And so what we're looking to do is defer to our medical direction on what protocols we should put in place initially, and hope that we can continue to expand testing. There's nothing that I've seen to date from a public policy standpoint that would tell me that more testing is a bad thing. Obviously, there's capacity constraints. Obviously, we have to be wise about the usage of our resources. But in the long term, for our community, and I think for every community, in the coming weeks and months, we're going to have to get to a point where we literally will be able to go on a website, City of Fisher's website, and just like you're checking the weather, you should be able to see the forecast for what COVID looks like. I mean, how many infections? There's some really interesting work in antibodies. All of those things are things that we have to consider and be adaptive and nimble to as we move forward.
Thank you.
Yep. Thanks, Eric. We have a few other questions, Ashley. Go ahead, Kurt. Go ahead, Kurt.
Hi, thanks. Yeah, just following up on that, you had mentioned at the top of your comments that the intent is to use about $2 million to provide testing. First, I'm wondering where that money originates. And then second, I'm wondering what capacity that $2 million provides. Do you anticipate that lasting several weeks? I don't know if you have the cost per test to do those sorts of calculations, but I'm wondering how far you can stretch that $2 million.
Great question. So the $2 million is what we believe at this time we can pull from, cash reserves. Now we have significantly more cash reserves than 2 million, but this is a measured approach. $2 million at this point, we believe will secure more than enough tests for the foreseeable future. It just depends upon the demand in our community, but right now this would be the equivalent of testing almost 1/3 of our population would have the ability to do that. Now, obviously, we're viewing this as a long-term strategy. So it's not about how do we run out and get everyone tested immediately. It's how do we put the infrastructure in place over the long haul so that, again, when Governor Holcomb and Dr. Box make the informed decision, and I trust and respect both of them very much, and they're going to make the decision that they need to, that when they do that over June, July, August, September, we're going to have the ability to understand what is happening in our community, what is happening in our businesses, and adapt accordingly. We believe that this initial investment will certainly be enough to get us through the initial onset of the economic recovery and hopefully get our businesses and everybody up and moving again. Additional questions, Ashley?
Can we discuss rent relief options? Rent will be what contributes to failure in business in the next few months. There is no way to make up rent from March, April, and soon to be May, even with PPP loan dollars.
So the question is, for those that weren't able to hear it, is would the city entertain rent relief? From my perspective, the loan program that the Economic Development Department, along in partnership with One Zone and our redevelopment commission, if there was an opportunity, obviously that money through the startup loan program and reentry program would be available and eligible for rent payments. So from our perspective, that would be the avenue to pursue to the question of would rent be alleviated somehow. Additional questions, Ashley?
How will small businesses go about applying for recovery loans from the new program?
It's a great question. So I would have a website up probably yet today that will demonstrate or at least allow you to sign up via email that you're interested in this. And our hope is early next week to roll out that program, and you will be able to file your application. We are cognizant and sensitive to the fact that people are in dire need. We are cognizant and sensitive that we want to align this with the governor and Dr. Box's reentry and reopening plan. And so we will work accordingly, but rest assured, we have a very robust communications plan that we plan to roll out along with all of these actionable items today to ensure that our community is ready to go and well-informed. And the website, fishersrecovery.com, happens to be on your page as we speak.
This is Michael Young with Purdue University Manufacturing Extension Partnership. We primarily provide training services on-site with clients around the state who would be best to connect with to establish guidelines and procedures for our staff.
So this is a fantastic question. A subject matter expert around manufacturing offering their services. I think one of the things that we're working diligently on right now and feverishly, and I'm certain we're not the only ones, is if you're a restaurant, what is the best practice to open up? If you're a manufacturing facility, what is the best practice to open up? What is the equipment you're going to need? All of these questions are floating around. If you're a church, how do you open up and worship in a safe manner? We are going to dedicate people, expertise. We have subject matter experts we're working with right now to develop a concise and consumable piece of information for each one of those industry verticals, so that when our team is out meeting face to face with that business owner, we can walk through all of those questions together. I think that is part of the real value add of a comprehensive program like this, is just the recognition that as a small business owner, especially over the last 5 weeks, if you've just been pummeled, that to start to think through, well, do I have to move my tables 10 feet away? Do my waitresses and waiters need to wear masks? We're going to do a lot of the homework for our businesses, and then we're going to go out and we're going to coach them, train them, and work with them to ensure those practices are held up. So I appreciate the offer, and we will definitely look to anyone who's a subject matter expert so we can decipher all of this. Ashley?
What about people who work in Fishers but are not Fishers residents? Will we be able to have the opportunity to be tested?
So the question is, if you work in Fishers and don't live in Fishers, will you have the opportunity to be tested? This is nuanced. Yes, you will have the opportunity to be tested if your business has a program that allows that. So the difference here is any Fishers resident will have the ability to get a test for free, paid for by the city of Fishers. If you are a business and you want to start a program because your employees, you want them to be tested, we will allow access to our testing site, which will bring down the cost. We will allow access to a customized data port through Qualtrics, but you will have to pay for the individual test yourself. Your employer will have to pay for that test. Ashley?
I don't see any other questions.
Okay, last call for any additional questions. And again, I want to make a plug for our partners here, Community Health, and Brian Mills has been a true partner, as well as Mid-American Clinical Laboratories and Qualtrics. And I want to thank my team here, my incident management team have been incredible. And we look so forward to coming alongside all of our businesses, coming alongside all of our residents. We are going to get through this. We are going to recover, and we're going to position our city to be successful, vibrant, and well into the future. And I wish Governor Holcomb and Dr. Box the best of luck in the difficult decisions that they have ahead, and just know that we as a community stand ready and will be ready when it comes time to open back up. Thank you all for your time today. Oh, I'm sorry, one more question. Go ahead, Larry.
Sorry, Ray, I'll make this quick. Last statistic I saw from the county health department was that 8 people with the Fishers address had been verified as passed away from COVID-19. Do you know how many people living in Fishers have died of COVID-19 up to this point?
The only information that I have would be the same that you have, Larry, in terms of 8 people having passed away. And that's to the extent of the data that I know regarding that. But we certainly hope once we stand up this infrastructure, we'll have a much clearer picture of what specifically is happening in our city.
Thank you, Mayor.
Yes. Oh, we have another question, Ashley.
If we are unable to find proper sanitation supplies or cleaning supplies, is there a way for the city to help get us access?
So the question is around, if you're a small business owner and you're about to get started and you find out that you have to have masks or cleaning supplies, how would you go about doing that? We are contemplating and moving forward with an outline of a program that will go right alongside our business recovery teams, where we would have a PPE starter kit for each business. Now, we want to make sure we source that respectfully. We do not want to take any resources away from public safety, first responders, hospitals, critical need. But if we get to a point where resources are plentiful and that opportunity is available, the city will also start a PPE program where the initial starter kit will be provided to a business. We will not be the source of PPE ongoing, but to help people get on their feet, we are contemplating a program like that. The only caveat I would put is we're constantly evaluating the landscape of what is needed from first responders, hospitals, things of that nature, and certainly wouldn't want to step in the way of that supply line. But if we feel confident that their needs are being met and we have the ability to step in and help, we do have an outline for that program. So thank you for bringing that up. I don't believe we have any other questions. I wish everyone a happy Thursday, and stay tuned on our website, fishersrecovery.com. We plan to get to work here very shortly. Thank you.